Okay, hi everyone. I'm Tracey Chenier and I'm a theriogenologist in population medicine here at OVC, and I'm very happy to present our results of our Neospora in Ontario Broodmare study that we've done. So what is Neospora and why is it important? It's a cyst-forming protozoan parasite, and for us in horses we have two species of interest, Neospora caninum and Neospora hughesi. For those of you that do cattle or have done cattle previously, you are well aware of Neospora caninum and its importance worldwide as a very significant cause of abortion in cattle, including in Ontario. In horses, for us, you guys might be familiar with hughesi as a rare cause of EPM, and it has been confirmed as a cause of EPM in cases that have been negative for sarcocystis. So knowing the life cycle is important to understand risk factors and how we might avoid exposure. So Neospora caninum, the life cycle is known, and canines, so dogs, coyotes, are the definitive host. So they become infected and then they excrete oocytes in the feces, and that contaminates feed and water sources that are intermediate hosts such as cattle or horses then ingest. And those intermediate hosts are basically any mammal pretty well, so cattle, horses, rodents, and so on. Neospora is also highly efficient at transplacental transmission, and so an infected dam can pass that infection on through the placenta to the fetus, and that's how it causes abortion in cattle and horses. The life cycle for Neospora hughesi is not known, and so that creates a problem for us, and we do need to find that out. So why are we interested in this in horses? Previous studies around the world have shown that there's high seroprevalence or exposure in horses in some countries, including areas of the United States, France, and especially in Israel. And other studies have shown an association between mares that are seropositive and a risk of abortion and pregnancy loss or reproductive failure. It was recently identified and confirmed in cases in several countries in the United States, France, and in Israel as a positive cause of abortion in horses. So it's really emerging not just as an abortive agent in cattle, but also in horses. And a recent study in Israel, they looked at fetuses submitted that had been aborted, and 42% of those were positive for Neospora caninum on PCR and histopathology. So we wanted to look at this because there were no previous studies on Neospora in horses in Canada. So 63 farms we enrolled from across Ontario, 219 broodmares, and we submitted the blood to the UC Davis for E.5 to determine serology, and we were able to do both Neospora caninum and Neospora hughesi in this study. And then we asked farm owners or farm managers to do an online survey where they gave us, we evaluated several management factors so that we could look at risk factors for seropositivity or exposure. I think it's really important to remember that these are healthy horses in our study. So in our case, seropositivity just means exposure. It doesn't mean disease. We also accepted abortions in our study, and we're testing them for Neospora, and that was a bit of a problem with the pandemic with closures and so on. So the results of our study for Neospora caninum, 27% of our broodmares were seropositive for Neospora caninum, and about half of farms had at least one mare on the farm that was positive for Neospora caninum. We only accepted broodmares into the study that were resident in Ontario for at least a year, so we didn't take mares that were transient. Maybe they went to Kentucky for breeding and came back here, so they had to be residing in Ontario for at least a year. The risk factors that we identified for caninum, very similar to cattle, was dogs on the farm, not surprisingly, and high stocking density. It's interesting, and it might surprise you, that actually having other livestock on the farm was associated with a lower risk of exposure to Neospora caninum. We're not quite sure why that is. It might be that those farms that have other livestock have better biosecurity practices. It's also possible that those other species act as a bit of a vacuum and lower the amount of oocysts in the environment for the horses on the farm. But that was an interesting finding. For Neospora hughesi, over 29% of the broodmares in this study were seropositive, and there was low cross-reactivity between the two species of Neospora. And again, about half of farms had at least one broodmare on the farm seropositive for hughesi. The only risk factor we identified in this study, in our analysis, was the practice of feeding hay on the ground outside, and that, that provides an opportunity for a contamination from the definitive host for the horses to pick up. So what does that mean? What's the take-home message here? It's apparent that exposure to Neospora in our horses in Ontario is pretty widespread, so about 30% of horses. So how do we avoid exposure? When this first came out with cattle, a lot of cattle farmers panicked and thought they had to euthanize all their dogs, right? Horse owners aren't going to do that. And it doesn't mean that the horse owners need to get rid of their dogs, but it is really important that they pay attention to where they're defecating, right? So we need owners to think about not allowing dogs access to feed storage areas, not encouraging dogs to defecate in and around hay feeders. I think it's important that they don't feed dogs raw meat, because that's obviously the way the dogs can become infected. Use hay feeders outside, encourage them to keep the hay up off the ground, so that even whether it's farm dogs or coyotes, that they're not contaminating where the horses are eating. Biosecurity is really important. So it's transplacentally infected as well. So if there's abortions or placentas when they're passed, don't put them on the manure pile so the dog can grab them, take off with them, right? And think about standard things like reducing stocking density, pasture management, and so on, just to reduce all the contamination that's out there. And I'd like to thank those of you who got farms for me, enrolled in the study, and sent me blood. I couldn't do it without you. And my master's student, Olivia, on the project, and the epidemiologist, Dr. David Pearl, as well as Equine Guelph and Amafra, who generously funded my study.